Welcome back to Official Senior Health, the channel dedicated to providing the best tips and advice for living a healthy and vibrant life at any age. If you're new here, make sure to hit that subscribe button and ring the bell to never miss out on the essential health tips that could change your life. Today, we're diving into a hot topic: ginger. You've probably heard all about its amazing health benefits, right? It's commonly touted as a miracle spice that helps with everything from digestion to fighting inflammation. But hold on a second. While ginger is indeed beneficial for many, it's not for everyone. In fact, there are certain health conditions where ginger should be avoided completely. In this video, we're going to reveal who should stay away from ginger and why, so you can make sure you're not causing harm while trying to be healthier. What if I told you that something as simple as ginger could be making your condition worse? Yes, you heard that right. Ginger might not be the best option for everyone, and for some of you, it could be doing more harm than good. Stick around because by the end of this video, you'll have all the information you need to know if you should steer clear of ginger for your health. Ginger and its many benefits. Before we dive into the details of who should avoid ginger, let's talk about why it's so loved by the health community. Ginger has been used for thousands of years in traditional medicine for its powerful healing properties. Whether consumed fresh, dried, or as an essential oil, it contains bioactive compounds like gingerol, which are known for their anti-inflammatory and antioxidant properties. It's great for relieving nausea, soothing an upset stomach, and improving digestion. But with all its goodness, it's important to understand that no one health remedy works for everyone. Let's go over some specific health conditions where ginger could actually be harmful. You might be shocked to learn that ginger can interact with common medications and even cause certain side effects in some individuals. This could lead to complications that you don't even realize are being caused by this so-called healthy spice. 1. People on blood thinners. Ginger can act as a natural blood thinner, and while this may seem beneficial for some, it can be a problem for those who are already taking prescription blood thinners like warfarin or aspirin. Blood thinners are used to reduce the risk of blood clots, strokes, and heart attacks, but adding ginger to the mix can increase the risk of bleeding. Ginger contains compounds that can inhibit platelet aggregation, the process by which platelets stick together and form blood clots. This means that if you're on blood thinners, ginger could intensify the effects of your medication, leading to excessive bleeding, bruising, or even internal bleeding in some cases. If you're taking blood thinners, you must speak with your doctor before incorporating ginger into your diet. Even small amounts could be risky for your health. Are you one of those people who love to sip on ginger tea or enjoy ginger in your daily meals? What if I told you that this might not be such a good idea if you have a certain health condition? Keep watching to find out if you should avoid it altogether. 2. People with gallstones. Did you know that ginger can be a problem for those with gallstones? Gallstones are hardened deposits that form in the gallbladder, and they can cause pain, nausea, and even blockages in the bile ducts. Ginger is a natural stimulant for bile production, and while this is generally good for digestion, it can be a problem for people with gallstones. For those who suffer from gallstones, ginger's bile-boosting effect may exacerbate the condition. Increased bile production can lead to more intense pain and discomfort, or even trigger a gallbladder attack. So, if you have gallstones, it's best to steer clear of ginger or consult with your healthcare provider before consuming it. 3. People with acid reflux or GERD, gastroesophageal reflux disease. Acid reflux or GERD is a condition in which stomach acid frequently flows back into the esophagus, causing symptoms like heartburn, chest pain, and regurgitation. While ginger can help with digestion, for some people it can worsen symptoms of acid reflux. Ginger is known to relax the lower esophageal sphincter, which is the valve that prevents acid from flowing back into the esophagus. For people with acid reflux, this means that ginger could make the symptoms worse. If you suffer from GERD or frequent acid reflux, you might want to avoid ginger altogether or consume it in very small amounts. Did you think ginger was a natural remedy for your digestive problems? Well, for some, it could actually worsen the issue. If you have one of these digestive conditions, you might want to rethink that cup of ginger tea. Let's find out why. 4. People with ulcers. If you have a peptic ulcer, whether in the stomach or duodenum, you should be cautious with ginger. While ginger is known to soothe the digestive tract and relieve nausea, it can also irritate the lining of the stomach. The reason ginger might be an issue for ulcer sufferers is that it stimulates the production of stomach acid, which could irritate the already sensitive ulcer area. The increase in stomach acid can lead to further discomfort, pain, and even more serious complications like bleeding or perforation in the stomach lining. If you have a history of ulcers, it's important to avoid ginger or at least check with your healthcare provider to see if it's safe for you. 5. Pregnant women. In certain cases, ginger is often recommended for pregnant women, especially to combat morning sickness. However, while ginger can be beneficial in small amounts, excessive consumption during pregnancy could lead to complications. High doses of ginger may increase the risk of bleeding and could even cause contractions in the uterus. If you're pregnant and dealing with morning sickness, ginger can certainly be helpful in moderation. But it's crucial to speak to your doctor before using ginger regularly, especially if you're in the later stages of pregnancy. Do you know that ginger can actually affect your blood sugar levels? If you have diabetes, this could be a big concern. Let's break down how ginger interacts with blood sugar and why you need to be careful. 6. People with diabetes or low blood sugar. Ginger has been shown to have potential blood sugar lowering effects, which can be beneficial for some people with diabetes. However, for those who already have well-controlled blood sugar, or for people prone to low blood sugar, hypoglycemia, this can be risky. If you're taking medication to manage diabetes, adding ginger to your diet may cause your blood sugar to drop too low. Low blood sugar can result in dizziness, confusion, weakness, and even fainting. This is why it's essential to monitor your blood sugar levels closely if you decide to include ginger in your diet, especially if you have diabetes. You might think ginger is the perfect remedy for your cold or flu, but if you have any of these health issues, it could make things worse. What you don't know about ginger might surprise you. 7. People with heart conditions. For individuals with heart conditions, including those with arrhythmias or high blood pressure, ginger may cause some complications. Ginger can stimulate circulation and increase heart rate, which can be problematic for those with heart arrhythmias. For people on medication for high blood pressure, ginger may also interfere with the effectiveness of their drugs. If you have any sort of cardiovascular issue, it's a good idea to consult your doctor before regularly consuming ginger. While it may help with inflammation and heart health in some cases, for others, it could trigger unwanted reactions. So as you can see, while ginger is a wonderful herb with many health benefits, it's not always the best choice for everyone. If you suffer from any of the conditions we've discussed today, it might be time to reconsider your love affair with ginger. Remember, always consult your healthcare provider before adding anything new to your diet, especially if you have a pre-existing condition. Your health comes first, and your doctor can provide guidance tailored to your specific needs. If you found this video helpful, make sure to hit that thumbs up button, subscribe, and share it with anyone you think might need to hear this important information. And don't forget to turn on notifications so you never miss a video from us at Official Senior Health. Stay healthy, stay happy, and we'll see you next time with more essential health tips.